Well, the Delta variant is leading to rising infection rates across Wisconsin and the country.
There is renewed urgency for people who have symptoms or are traveling to get tested, even if they've been vaccinated.
The principal investigator for the UW COVID-19 convalescent plasma program, Dr. Bill Hartman, is with us for our weekly visit. Welcome, Doctor. Thanks for being with us.
Hi, Dr. Hartman. Thanks for joining us.
What is the situation right now in southern Wisconsin in terms of COVID and the Delta variant?
Well, the Delta variant is sort of rewriting the story of COVID right now. We thought we had gotten past the worst of things, and now we have this variant that's much more transmissible, that there's much higher viral load, so it's easier to transmit, and it's causing an increase in the number of breakthrough infections, even in the vaccinated people. And so we are seeing quite a bit of spread. In the United States overall, we're back up to 100,000 cases a day. It's definitely trending in the wrong direction, but hopefully we can get this under control.
Do we know what percentage of cases are those breakthrough cases that is fully vaccinated people who are testing positive? Is there a way to kind of put in perspective how much of it is breakthrough cases and how much of it is the unvaccinated?
Well, there's a couple of counties that are reporting the data of breakthrough infections, and I'm not sure that they're reporting it completely accurately, but if you look at LA County in California, they say that 1 in 5 of their overall COVID cases is a breakthrough case. This is replicated in a much less dense county in Monroe, Iowa. Again, they're seeing about 17 or 18% of their total cases as breakthrough cases.
But people that are vaccinated are not getting as sick or hospitalized as people that aren't vaccinated, but they can still spread the virus, correct?
Right. So the vaccines continue to be very, very, very effective at preventing severe disease, hospitalizations, and death. And across the country, here in Wisconsin and elsewhere, we're seeing the hospitalization of unvaccinated people. And so the vaccine is still very protective. You may catch COVID, but the likelihood that you get sick from it is still pretty uncommon.
Yeah, that's an important message. Well, every state is now reporting substantial community transmission of COVID. And of course, those rising infections are coming just as thousands of unvaccinated children are getting ready to go back to school. We have a mask mandate in most schools in the Channel 3 viewing area. Kids will be wearing masks. But what's your advice for parents who are starting to feel anxious about what the fall will bring?
Well, the school boards have been meeting very consistently to try to come up with the best and safest plans for the kids as they return to school. We are seeing an increase in COVID in children across the country, but children continue to not get as sick from COVID, and a good portion of them remain asymptomatic. And so while they can still catch COVID, while they can still pass COVID on, they tend not to get quite as ill from it, which is encouraging. Also, we know that masking and distancing in schools, along with increased vaccination of over 12 and the teachers in the schools, is really going to make a difference in terms of the kids going back to school and having in-person class.
How can we get a handle on this?
Well, the best weapon that we have are the vaccines. And so we need to increase the amount of vaccination in our country. Every unvaccinated person that the virus infects gives it the opportunity to mutate and make itself even stronger. And so we need to get ahead of these variants as quickly as we can. The best way that we have, the best weapon that we have right now are these vaccines.
Get vaccinated. That's the bottom line. Doctor, thanks for being with us today.
Thank you.
Thank you, Dr. Hartman. We appreciate your time.